Welcome to our first lecture, Introduction to Behavioral and Social Determinants of Health. Social determinants of health, or SDOH for short, are conditions in which people live that serve as important factors associated with particular health outcomes. For example, where you were born or grew up may determine type of quality of medical care you had even early on, even in the womb. So you can see that with the type of quality of care you have in the womb, that your maternity care your mother was able to receive, that will have an impact on your development as a baby. And of course, if certain things are not treated early on, it may impact how you develop into your adolescence, even have an impact into your adulthood. Your current residence, the condition of your neighborhood have important influence on your health as well. Regarding condition of your neighborhood, whether there is a walkable sidewalks in your community where you live, availability of parks, is there a high crime? All of these factors have great implications for health and mental health outcome. So there's a say in public health that says, tell me where you live and I can tell you your potential health outcomes and overall well-being. So it's important. This particular saying is emphasizing the important impact of the physical environment, which indicates the nature of the quality of life, whether you have access to resources, like food access, access to quality of food, even being able to get a good night's sleep can be dependent on your physical environment. As we know, sleeps impact all aspects of our lives, our cognitions, memory, ability to initiate or complete a certain task. So the research shows, people who report living in an unsafe neighborhood or neighborhoods that have been shown to be unsafe based on measures of safety, reported crimes, where there is a higher rate of crimes in comparison to neighborhoods with low crime rates. Residents of high crime neighborhoods tend to, because they're on alert, tend to report chronic difficulties with sleep. So poor sleep can have a dire impact on your health. So SDOH plays an important role in aging as well, and the quality of the life we have as we get older, including the prevalence of disease conditions that impact a certain population as they age. We go more into age and other determinants of health in subsequent modules. Before we delve more into social determinants of health and various factors that work to impact health, let's just briefly define health. So first, health as a concept, the World Health Organization in 1947 described health as absence of illnesses, not having chronic conditions, also the presence of well-being. They also added and view health in a very holistic way. It's not just physical health, but mental health, social health, and financial health as well. In social health, one way that has been looked at or assessed within public health is really like community cohesion. So social cohesion. What is the dynamic of the neighborhood? Are people close? Do they feel supported? All of that has shown to be related with health and financial health, which makes sense, right? If you financially healthy, being able to provide for yourself, you can see how that is associated with health as a whole. Viewing health as political is also part of how the World Organization define health, because policies impact health. Policies trickle down to allocation of resources that in turn impact a population, a community, etc. So adding to that definition, physical health is just optimal physical health, not just be able to function to a certain extent, but function optimally to the point that you're able to complete various tasks that you have in your day-to-day life, being able to achieve your goals, the goals that you have for your life that require optimal physical function. Being mentally healthy means that you're able to cope with life stressors. However, that does not mean that one does not feel down ever or at times feel depressed, but overall you are not staying in that state or that depressed state for long term, which in turn impact health and how you function in your day-to-day life. So why do we care about mental health and public health? This is because physical health and mental health have a bi-directional relationship, meaning that one impact the other. So if you have major depressive disorder, which is a psychiatric condition, which some of the hallmark symptoms include, feeling down most of the day, feeling like, completing the simplest tasks like moving a mountain, loss of interest in previously enjoyable activities. This depression has shown to be a risk factor for developing many chronic conditions, including cardiovascular conditions. So well-being is also associated with, is defined based on positive state, being in a positive state, having a positive affect. And well-being is associated with social and economic and environment, the physical environmental condition. So behavioral determinants of health. So we've looked at social determinants of health, but behavioral determinants of health, these are some examples of unhealthy behaviors which serve to increase risk for developing many chronic conditions, including certain cancers, cardiovascular disorders. And social behavioral determinants of health are influenced by the social and physical environment in which people live. Behavioral determinants of health are associated or outcomes of social determinants of health. It makes sense that where you live, if there's a high crime neighborhood, if you live in an economically destitute neighborhood, you have low access to resources. And that in turns may increase stress that lead to alcohol abuse through smoking as a way to cope. That's one example. So these conditions in which people are born, work, live, and age, according to WHO, represent wider forces of system that result in social stratification, which lead to unequal position of different groups, for example, racial and ethnic groups, and to indicate different levels of power, prestige, and access to resources. Think about these forces in structures. For example, economic and social policies are used to explain the nature of social determinants of health across, for example, the vulnerability and risk or prevalence rates of different health conditions across population. Public health policies can directly or indirectly influence health, since they influence availability of resources like health services, health insurance benefits, and prevention programs that residents within a neighborhood have access to. Social policies work to impact health, giving their effect on social and economic status. These are the main domains of healthy people for addressing health disparities and increasing health outcome. Healthy People is a report that outlines a 10-year health objectives, as well as strategies toward increasing health equity and promoting health outcome. How economic stability is determined, for example, is through composite measures that influence that includes level of education, job opportunities, and income. Having a steady income requires that one is employed and earning a living where they're able to afford, for example, a healthier lifestyle, being able to afford health insurance, buy healthy food, and living in a residence where you have, for example, opportunities to exercise. And I will look throughout the course, I will bring examples of physical activity because I am a physical activity researcher. So not living in an environment where there is, polluted air, polluted water, giving the risk for developing so many chronic disease conditions because of prolonged exposure. So accordingly, the goal of promoting economic stability is to increase steady employment among communities with high level of unemployment, poverty, homelessness. Of course, it is no surprise that, being employed, being able to afford, provide for yourself financially and your family is predictive of better health and mental health outcome. As you read the DOH document, the first reading in Module 1, increasing economic stability is one of the many goals of SDOH. These steps include increasing wages, which is an essential component of helping people not only to survive, but also to thrive. Economic stability has a cascading effect on being able to afford rent, right? Potentially, preventing homelessness and decreasing financial stress. Increased chronic stress is a strong predictor of poor mental health and physical health. So we will be talking about mental health and physical health as, not just the physical health, but also mental health as an important factor when we're looking at social determinants of health. Education is a major determinant of health since it is associated with employment opportunities, job opportunities, and income. Having access to quality education later on, early on as children, as an adolescent, is essential. So it really provides a strong scaffolding for high school readiness or college readiness. For example, it can be hard for a student or some folks to do college work or writing an essay because they have not had the opportunity to learn basic writing mechanics in elementary school and in high school. You could see that not having had access to quality education where you should have learned these basic mechanics, how this could lead to frustration in high school and in college, and eventually this person, continuously feeling that they do not have these basic mechanics to really do their assignments, can feel frustrated and potentially drop out of school, out of college because of difficulties to do, college work. So education early on does not impact the here and now, impact the child in the here and now. It really can impact you into adulthood. So in terms of your readiness to do various type of work, so having a clear, access to quality education is really essential and is an important determinant of health. As I mentioned, is not, access to quality education also not only allow you to be more prepared for college work and so on, but also it really helps for students who might find themselves struggling it allows you allow professionals to provide tailored curriculum to students that may have some difficulties or needs for which the curriculum need to be tailored to. So there, being able to have equity, educational equity, being able to receive a curriculum that really matches, that match your needs, that take into account in your needs. So this is really strongly important, because without having educational equity, you can potentially leave people behind, for whom early intervention, for i.e. a tailored curriculum that addressed their needs, could have addressed the problem early on and give them the support that they need to be academically successful. Healthcare access and quality. So having access to quality care, medical care, is essential. There are numerous annual exams that are preventative, that living in a certain part of this country or in this world, you're not able to have access to, because there's a lot of communities, populations wherein that, they don't have a clear primary care doctor with whom they're familiar, who knows their risk and can refer you for early screening for certain conditions based on your risk factors. For example, it may be at a certain age, based on your family history of cancer, you may need to have annual screening for breast cancer, or for some type of cancer for which you have a family history. So being able to have quality care is really important for preventative care. And also that quality care also trickle down to the type of health insurance you have, right? Because oftentimes I have worked with medical doctors where they wanted to send the patients for some, preventative screening, but the type of insurance that the patient have limits their ability to do that. Affordability of medication is also essential, is an outcome of healthcare access and quality. Not being able to afford your medication, you can see that how that could impact your ability to adhere to prescribed medication, and not being able to take your medication as prescribed may worsen your symptoms in certain situations. So, as I mentioned, specialty care, not preventative care, I mentioned, is also important, is essential, and folks who tend to have a consistent primary care, that have insurance that really facilitate early screening, preventative screenings, fare better in terms of health outcome, which kind of makes sense. If you're doing preventative care, you may be able to detect something early that can be treated, therefore decreasing the likelihood of it becoming chronic problems, or even developing and impacting your health on a larger scale. So preventative specialty care also is is directly impacted by quality care, the type of insurance you have. Referring a patient to neurocognitive testing, as a clinical psychologist, you may meet with a patient and you find that this patient may have some cognitive disabilities or certain cognitive limitations. However, that in terms of understanding the depth of these potential limitations, it requires neurocognitive testing. Being able to refer the patient for neurocognitive testing is also dependent on the quality of their insurance as well. And you can see that a patient that needs neurocognitive testing, folks that need neurocognitive testing and not being able to get that, and how their condition may actually worsen over time, and how that really could impact their health outcome, their ability to function in their day-to-day life, in their ability to function in different contexts. As mentioned earlier, your environment is a strong determinant of your health and mental health outcomes. So accordingly, your environment may serve as either a barrier or a facilitator to good health. There are neighborhoods where there is, as I mentioned, pollution, air pollution, water pollution, which have been shown to be associated with greater risk of cancer, cardiovascular diseases, respiratory problems. Unfortunately, some of the, within these communities, even though the residents might be aware of this, they may not have the financial ability to relocate. So a study by Hanneman and colleagues in 2023, published in 2023, found that death rates decreased after air pollutions were implemented in stopping the use of coal-powered plants within that region. So you can see that implementation of different policies, how this is important to impact the life of residents of various communities. The study covered data, 20 years of data. Another study by Zanabetti and colleagues, also published in 2023, found that neighborhood level factors were associated with a high rate of asthma in children. So the physical environment impact your health, and as I mentioned, unfortunately, a lot of folks do not have the ability to change their environment, so they're feeling it's almost like you're stuck waiting to develop certain conditions, given what you are being exposed to on a daily basis. I mentioned earlier that social health, social cohesion is one way that social health is mentioned, is one indicator of social health. So the type of relationship you have with your neighbors, with friends, or family members can serve as buffers against various stress. So people without social support tend to cope less with various adversities in comparison with those who report having social support. So this is why this is an important determinant that is included in SDOH, because it has essential impact on how we cope with adversities, and also has an impact on health as well. Community cohesion, how close you are and feel to your neighbors that I mentioned, can be perceived as a source of social support. And perceive a neighborhood cohesion is associated with psychological well-being, for example, life satisfaction, optimism, purpose in life, and lower psychological distress. So let's look at some programs that have targeted social and the physical environment in effort to increase, to promote health outcome. So one of such programs is a randomized control trial, RCT for short, assessing health effects of housing. So it consisted of 46,000 families in public housing, and they were randomly assigned to 3 conditions. Think of randomization as like a flip of a coin. So the first condition or group is called regular Section 8, in which the people in that group received a housing voucher for subsidized housing. Group 2, or condition 2, it was called the low poverty neighborhood, and they receive low poverty neighborhood plus counseling on relocation. And the control group just basically stayed in their housing. So the second group received counseling on how to relocate from public housing, while the control group did not receive any type of treatment. So the purpose of the control group, if you remember that a control group allow you to test different treatment methods or program on specific outcomes you want to measure. And in this program or study, it included some of the measures included physical health and mental health. So assessment were done after 47 years, 10 to 15 years. As well, there was some short-term assessment that were done within 1 to 3 years of the program. So overall, some of the results from the program show that for the second condition, exposure to neighborhood poverty significantly reduced. So this is the second group that were relocated, received the voucher after 50, even, and that impact remained after 15 years in comparison to the control group. And that treatment group had better physical health. In those composite measures of physical health was, low, not high obesity, lack of diabetes, or functional limitation. These are some of the measures of physical health they included, and had also been better mental health outcomes, meaning that they were reported low psychological distress and depression. So another program is the Housing Opportunities for Person with AIDS and Chicago Housing for Health Partnership. So the study tests the effect of aid vouchers on low-income patients who were diagnosed with HIV or AIDS, who were also homeless or at risk of being homeless. So they received Section 8 vouchers with case management, and the control received usual care, meaning that whatever treatment or whatever support that they, public housing, that they were continuing to receive, like housing services. The measures that were included in the study was number of days spent in the hospital, viral loads, CDC counts, mental health, days spent in the hospital. These are the measures of health and mental health that were included, and they were testing the effect of receiving these vouchers on these various measures. And the study program included other measures. So overall, they show that people, there were some important impact on mental health, including depression and stress. There were not that many significant outcome in terms of CD4 counts, viral loads, but there were positive effect on mental health, including depression and stress. Why is this important? This is really important because depression and stress impact how we function in our daily lives, and how we function can impact, our physical health. Our mental health impact our physical health. As I mentioned earlier, mental health and physical health, have a bidirectional relationship, which means one can influence the other. Often have a bidirectional relationship, meaning one can influence the other. So if you are if you suffer from depression, the likelihood that you're going to feel you're going to feel physically fatigued. That's one symptoms of depression. You might feel like mentally, you feel some slowness in terms your memory might be impacted. You may have difficulties retaining information. So it's long-term, short-term memory can be impacted. So you can see why while this program did not have a huge effect on a lot of physical health measures like viral loads and CDC counts, as I mentioned, but the fact that it impacts mental health and depression, that's really important. And for a patient population, that's really vital, because we know stress and depression can worsen your symptoms. So these are examples of programs that are targeting social and physical, the physical environment more so. So structural determinants of health is some overarching structures and forces and policies that impact behavior and social determinants of health, right? So behavior, said differently, behavior and social determinants of health are outcomes of various structures that serve to underlie disparities. Numembi Yo, and I'm probably butchering the last name, and colleagues, they define structural determinants of health as economic, cultural, political, and social structures that shape the distribution of material and symbolic power and resources, that in concert it concerns for health of the planet, ongoing legacies, and colonial racism. And emphasizing, as I put in bold, these structural drivers shape public policies across sectors, creating predictable inequities in health promoting resources across and between nations and community. Really, the emphasis on health promoting resources, as I mentioned, the central component of health disparity is allocation of resources that have been shown to impact and maintain disparities of health. And we will delve into this more so across different populations as we get into different modules of this course. Another definition, Broomhead and Baker, state that structural determinants of health are socioeconomic political mechanisms that generate and maintain social stratification, and in turn determine individuals' socioeconomic position according to income, education, occupation, gender, race, and ethnicity. So both sets of definition address overarching structures that trickle down to economic stability, lack of access to quality care, living in an impoverished environment with lack of access to, for example, even healthy food, being able to exercise, having economic stability. These systems include education, economic, social, and political, criminal, legal system, and healthcare system. So structural determinants of health, these things fall under the umbrella of social structural determinants of health. And of course, we can see how these structures play essential roles in maintaining the status quo. For example, racism, sexism, support hierarchies among groups, with race or gender group, with a particular racial or gender group remaining on top. These are not natural hierarchies, as we know, to indicate that intrinsically certain folks should be superior than others. Rather, they are socially made, and they are important drivers of inequity that we have seen for many, many years, that have led to chronic disparities in health across various populations. Accordingly, these overarching structure, work at the federal community levels, and they determine policies used to foster, for example, structural oppression. So structural oppression is said to address this, underlying discriminatory systems that are interrelated and show adverse effects on social determinants factors. So division of power at the macro level show that one group's at the top of the hierarchy and thus is more powerful, has more resources. Accordingly, resources available to one group is also superior to the resources available to the other group, the group that's at the bottom. The differences of resources over time work to maintain power differences between, for example, men and women, Black and white communities. You could think of, in various areas where there is, there is disparity. The micro level effect comes from continuous exposure to structural oppression at the macro and meso level. So accordingly, there is there's a burgeoning field within public health that recommend measures that assess different factors how these different factors are associated with health outcomes. So looking at macro, meso, and micro factors, how this impact health outcome. So it's not just looking at social determinants of health as a vacuum, but looking at the wider social structures, including structural oppression at various levels that work to really to maintain the status quo. So a recap for this lecture. So we covered social determinants of health, and looked at social environmental factors that have that are strong correlates of health outcomes. I provided some examples of behavioral determinants and how they're related with the social environmental factors. For example, substance abuse, which is unhealthy behavior that we know is predictive of many health outcomes, can be related influenced by the social environmental environment, the social and the physical environment in which people reside. So decreasing health disparities requires addressing inequities in education, economic status, housing, which are among the main objectives of SDOH. So differences of social determinants of health, these things do not happen in a vacuum. We're looking at upstream factors, as one of the articles in Module 1 termed. These are structural oppression that define how social determinants of health impact groups, racial or gender group differently. Social programs provide empirical evidence for interventions that can address various factors, including downstream factors such as social and the physical environment and how their impact on physical and mental health. Changes at the policy level, however, is really essential to eventually have a really significant impact on social determinants of health, because it really influences allocation of resources and quality of resources that really represent or show how different social determinants are manifested across different populations. These are some additional references in addition to the articles for Module 1 that really, if you have time, you can delve into other references. So thank you for reviewing this lecture and listening to this lecture. I'm sure I can't wait to read your responses in the discussion board and defining social determinants of health and how it relates to your area of research, work, life, etc. All right, see you then, next module.